Okay. Hello and welcome to LUWI Foundation. We are here to discuss the nursing care plan, a very, very important kind of management that we are using in our day-to-day as we provide nursing care to our clients. So I'm going to start with a very simple definition. So I'm going to say a nursing care plan is just a document that is outlining, it is a written document that is outlining the kind of nursing care we are giving to the client according to their individual needs. Each client has their own individual needs. So today we are going to learn some simple points and problems that we can identify on our nursing care plan and how best we can hack it and pass it. Okay, so we should prioritize in the way we are identifying these problems. There is no way a patient has come in and they have difficulties in breathing and you say knowledge deficit. You even start it at the first. No, we want to prioritize. The first problem that they are going to have is the impaired breathing patterns. They're not breathing properly. So let us deal with their breathing, then we are going to go to the rest. Priority, very important. And we should mind the way we identify problems. So if a patient comes, you have to assess, or you've been given a STEM question, you have to assess. Is it by any chance affecting the respiratory system and the breathing of the patient? If it is, then you're going to tell the examiner that you're going to identify one problem, which is impaired breathing patterns. Or you can identify another problem, which is ineffective airway clearance. Okay? Then the rest is just the same. The other point I want to emphasize is that avoid identifying conditions as nursing problems or the problems that a patient is facing. For example, a lot of people like identifying anxiety as a problem. Anxiety is not a problem in the nursing care plan. Anxiety is a condition in mental health and it has its own management, how we manage it. So we avoid by all means to identify conditions. Because if you identify a condition, it means you have now to explain in the diagnosis the investigations that you've carried out for you to know that this patient has that condition. You also have to support your answer and give all the evidences. That's why we have to go to the lab and everything. That's why we avoid identifying conditions as the problems. Even fever, we are not going to say fever because fever is a condition. We have to do investigations for us to know that the patient has fever. Identifying fever, identifying anxiety, identifying dyspnea, it's just the same as identifying malaria as a problem on the nursing care plan, which we are not supposed to identify as a problem. So when we're identifying things like fever, that's why we are saying elevated body temperature or altered thermoregulation. When we're identifying problems like anxiety, we simply say knowledge deficit. Okay, instead of just saying anxiety. We're not going to say dyspnea as well. We are going to say impaired breathing patterns, ineffective airway clearance. All those are points that can be associated with what? With dyspnea. It is very, very important to So when we are writing a nursing care plan, for starters, we need to have a paper which is put in landscape. Okay. And once we have it on landscape, we are going to draw a table. That table is going to have 5 columns, of which the first column is going to have the heading that is going to be saying problem identified. The second column is going to have the heading that is saying nursing diagnosis. The third column is the column for the objectives or the goals. Then the next column that is following the objectives, we are having the nursing interventions and the rationale. Intervention is coming with the rationale. Then the last one, we are having our evaluation. So we are going to go into problem identification. How do we identify the problems that we are going to be putting on the nursing care plan? This is how we are going to do about it. When you look at the client that has been brought to you in the ward, or the client that has been in the ward, there are things they are not able to do on their own. Those are the problems you are going to be identifying as a nurse. By all means, avoid identifying a condition as a problem, because the condition has already been identified and diagnosed by the medical doctor or the medicalization or a clinical officer. So what you are doing is now to identify the problems that the patient has right there. I can give an example of the problems. For instance, if a patient is sick, they are not able to take care of themselves. There is self-care deficit. Self-care deficit is one of the problems that we are going to identify. So we are going to say problem identification, self-care deficit. Okay? So now let us categorize these problems. There are problems that have everything to do with the respiratory system. There are problems that have to do with the general conditions. There are problems that are coming with the infectious conditions. There are also problems that we find in pediatrics. So this is the general management. I'm going to give you the problems according to the classifications, the ones that are falling in emergency conditions, the ones that are falling in life-threatening conditions, and the ones that are falling in pediatrics, also the ones that are falling in mental health, also the ones that are falling in other conditions. So as I'm speaking, there are problems running on the side of the screen for you according to the categories. So we can go direct into writing. So in writing the nursing care plan, I am just going to pick on one problem that we are going to go with until we get to understand and learn how to write the nursing care plan. Okay, so we are not going to discuss all the 5 problems that we are supposed to write. We are just going to pick one. Then we're going to give an example on that one. We are going to pick elevated body temperature. In elevated body temperature, others would say fever, but I'm going to encourage you not to write fever. Fever is a condition on its own, and I'm sure you will learn fever in certain courses as a condition. So we are going to say elevated body temperature or altered thermoregulation. That is going to be our problem identified. What diagnosis are we giving? The nursing diagnosis is now you giving a reason to why that fever is coming about, to why the body temperature of the patient has been elevated. Why is it elevated? Give the reason to that. And the other part in diagnosis is that how do you know that this person's temperature has been elevated? So in short, in diagnosis, it is you giving a very brief and simple pathophysiology. That's where we say elevated body temperature related to this and that, or due to this and that. And you also give an evidence, what evidence you have for you to say that person's body temperature is what? Elevated. So we are going to say in case of fever, which we are writing as elevated body temperature, whenever we have it, we should know that there's a presence of what? Infection in this patient's body. Okay, so we are going to say elevated body temperature due to the presence of infection, evidenced by the body temperature of above 37.5 degrees Celsius. Okay, because 37.5 degrees Celsius is the normal that we have. So if it goes above, it means this patient has a high fever. Then we are going to go to the objective. What are we saying in the objective? The objective is the goal. You're giving yourself a target that you have to meet. That's why we have the objective, which is also the goal. So in the goal, in the case of elevated body temperature, we are going to say to maintain normal temperature, or to maintain normal body temperature for Mr. Banda, or whichever name you have been given, throughout hospitalization. A long time people used to say to reduce by these degrees in that degrees, but nowadays you can just say to maintain the norm. And when writing the objective, we always say to do this, to do that, because that's what you want to achieve. When you write, then you are going to go to our nursing intervention and also rationale. So now, what are you going to do as a nurse about that problem you have identified? That is nursing intervention now. That's why you are going to write 5 points in there, and that will be your 5 marks. Do not put the medication you are giving. That's not your job. That is the job of the medical doctor, the medical assistant, the clinical officer. You are saying things that only a nurse is supposed to do. Okay, so in the case of fever, that's where you postpone the patient, that's why you open the nearby windows, all those, etc., etc. So, and when writing there, we always say, I will do this and that. If you are opening nearby windows, you're going to say, I will open nearby windows. Why are you opening nearby windows? So that we can allow air circulation and the exchange of air through what? Convection. That is the rationale we have given. So you have to come up with now 5 points that are supposed to enter in there. What a nurse is doing. Then the last part is the evaluation. You now evaluate. The goal that you had, you evaluate it. Have you met the goal or have you not met the goal? In the evaluation, it is going to tell. Okay, so in this case, we have met the goal. Because if you tell the examiner to say you haven't met the goal, they are going to mark you wrong. Nothing has been done on that patient. So we are going to say, the body temperature was maintained within normal ranges throughout hospitalization. And it was evidenced by the patient having the normal body temperature of 36.7 degrees Celsius. So you can say any range within the normal, because the normal body temperature is a range between 36.5 and 37.5. Anything within that normal range is going to give you a plus. So in the first column, up to the evaluation, in the first row, up to the evaluation, we have 10 marks in there. And since you have to identify 5 points or 5 problems, it is going to give you a total of 50 marks. And this is the only management that you can get 50 out of 50 in. So, when identifying problems, whenever you're dealing with a nursing care plan, you have to identify 5 problems as I've given you. And the first 3 problems should always be the actual problems, the problems that the patient already has, the problems that the ones you are seeing there. That's why we even say in the nursing diagnosis to say, this problem has been identified and it is evidenced by this, because the problem is there, you are able to see it. Okay? If you are unable to see it in the case of pain, there's going to be patient verbalization. It is going to be your supporting evidence. Then the last 2 are going to be what? Potential problems, the risk problems that can arise if the patient is going to stay in the same condition. In short, we are talking about the complications. In that, I can give an example of pressure sores. Okay? Pressure sores can arise if a patient has been confined to bed or they've been bedridden for a long time. So you are going to say risk of pressure sore formation as a problem in risk problems. Then on the diagnosis, you are going to say risk of pressure sore formation due to a patient being confined to bed or patient being bedridden. Here, there is no evidence. That is a potential problem that is not there. You are unable to see it. You can't see it because it is not there. It is a risk what? Problem. So there is no evidence there. Okay. So what I've given you is a brief of the nursing care plan, and I hope it is very clear for you to understand. If you want to know more on the nursing care plan, feel free to ask questions in the comment section. You can also come to our WhatsApp. The number is running on the screen. Make sure you inbox. We are going to attend to you. You can join our tuition center. write on WhatsApp. On WhatsApp channel, we are going to attend to you. Follow our Facebook